Dear students, welcome back. In this video we can see the grooves or sulci which are present externally on the heart. The atria are separated from the ventricles. This is right atrium. This is one is the right ventricle. So this part is the right ventricle, and this one is the right atrium, and this one is the left ventricle, and above this one is the left auricle. So most of the left atrium which is present on the posterior aspect. Okay, the atria are separated from the ventricles by a circular atrioventricular groove, or it is called as coronary sulcus. So this one is present on the anterior side, this groove, and on the posterior side these are the dotted lines, so which is present on the posterior side. So these are the circular groove. It is a circular groove which are separating the atria from the ventricles. Okay, and this sulcus is overlapped anteriorly by the arch of aorta and the pulmonary trunk. And the interatrial groove which separates the two atrium, right and left atrium, that is the interatrial septum or interatrial groove, which we call it as on the external feature. So that groove is faintly visible on the posterior aspect, but it is not seen on the anterior aspect. Anteriorly, that sulci is hidden by this arch of aorta and the pulmonary trunk. Okay, so that means here we can't see the sulcus, that is the interatrial groove or interatrial sulcus. We can't see anteriorly because the groove is hidden by these two great vessels. Okay, and posteriorly we can see very slightly. Okay, next the anterior interventricular groove. So this one is that means, so heart, these are auricles and these are ventricles. Okay, this is called atrioventricular groove, which is a circular sulcus or coronary sulcus, and this is separating the atria from the ventricles, whereas the interatrial sulcus which is separating the two auricles. Okay, and this one is the interventricular groove. So this interventricular groove separates the right ventricle and the left ventricle. This groove is present anteriorly as well as the posteriorly. So the anterior interventricular groove is nearer to the left margin of the heart, Okay, and this run downwards and to the left. So the here we can see this is the anterior interventricular groove which is separating the right ventricle and the left ventricle, which is present very nearer to the left margin, which runs downwards and towards the left. Okay, so the lower end of the groove here, separates the apex. This is the apex. So separates the apex from the inferior border, from the rest of the inferior border of the heart. So this groove, so by the left side of this groove will have the apex of heart, and by the right side will have the inferior border of the heart. Okay, this is about the anterior interventricular groove. Now, coming to the posterior interventricular groove, it is situated on the inferior surface. It is situated on the inferior surface. So you can see the dotted line. So it is placed like this. So it is present on the inferior surface or diaphragmatic surface. Okay, and this border is nearer to the right margin of the surface. So this border is nearer to the right margin of the surface. That thing we can see on the posterior side. Okay, so the posterior interventricular groove is situated on the diaphragmatic surface, not border, diaphragmatic surface of the heart. It is nearer to the right margin of the surface. This one is nearer to the right margin of the surface. Okay, and this anterior interventricular groove and the posterior interventricular groove. The two interventricular grooves meet at the inferior border near the apex. These two will meet at the inferior border near the apex. Okay, these are all about the grooves and sulci. Now coming to the apex of the heart. Now coming to the apex of the heart. Here we can see this is the apex. Yes, this one is the apex of the heart. This part. This is the apex of the heart. This is formed by the left ventricle. As we know that this is right atrium, right ventricle, and this one is left ventricle, and this one is left auricle. Okay, so the apex is formed by the left ventricle. How it is directed? It is directed downwards. It is directed downwards and forwards. So if you can see this one, so because of obliquely placed, so this part is the atria is present somewhat posteriorly, and this one is anteriorly. So how this apex is directed? It is directed downwards, forwards, and to the left. Directed downwards, like this, downwards, forwards, and towards the left side. Okay, and it is overlapped by the this apex is overlapped by the anterior border of the left lung. It is overlapped by the anterior border of the left lung. Okay, and it is situated, so the apex is situated in the left fifth intercostal space. So it is situated on the left fifth intercostal space. Okay, 3.5 inches lateral to the mid-sternal line. So if you have the sternum, so from the mid-sternal line, 3.5 inches away, 3.5 inches away, lateral to the mid-sternal line, thus apex of the heart is located, and it is just medial to the mid-clavicular line, and clavicle is there, so mid-clavicular line. So this is just present medial to the mid-clavicular line. Okay, in the living subjects, so that means in living beings like us, pulsations may be seen and felt over this region. If you put a stud on the fifth intercostal space, we can feel the pulsations of the heart. You can put your hand also, you can feel the pulsations of the heart at that area. Okay, it is situated in the left fifth intercostal space. Okay, and 3.5 inches lateral to the mid-sternal line, 3.5 inches lateral to the mid-sternal line, and which one is just medial to the mid-clavicular line. Okay, in the living subjects, we can feel the pulsations over this area. This is about the apex of the heart. And the base of the heart, we can normally the base of the most of the base of the heart is directed backwards. So base of the heart we can see on the posterior aspect of the heart. Thank you.